Welcome to today's session on pregnancy with self-oocyte, even at advanced age. To speak on the topic, we would like to welcome Dr. Ankush Rawat, in-house consultant for fertility, infertility specialist. He has done his MBBS, DMD, CCDM, and DNB. We welcome you, doctor. You can now take over the session.
Good evening, everyone. I'm Dr. Ankush Raut. I'm a consultant for fertility at Apollo Fertility Borivali. And today's topic is very important topic, and it is related to whether you can have a pregnancy even when your age is more than, let's say, 38, 39, or sometimes 40 years also. So pregnancy at an advanced age, whether it is possible or not, and if it is possible, in what way it is possible, all these concerns we will be addressing in today's session. So as we all know, pregnancy usually happens within 1 year of your marriage or 1 year of successfully trying for a pregnancy, almost in 90% of the cases. But in 10% of the cases, in 10% couples, they fails to conceive even after having a proper intercourse in a fertile window, having a proper intercourse even in a fertile window. And in many of them, there can be problem with the male or there can be problem with the female. And in the female, there can be problem with eggs, problem with the uterus, sometimes problem with the fallopian tube. Similarly, in the male, there can be problem either with the testis itself or with the hormones which is responsible for the production of a sperm. As we all know, the incidence and the prevalence of infertility is increasing day by day, and social factors, lifestyle factors, psychological factors, as well as environmental factors like pollution and excessive use of lead and mercury and other chemicals are also responsible for increasing in the incidence of this infertility. But one of the most important factor for increase in the incidence of infertility is the age factor. Now, in today's era, as we are focusing more on a career and education, in many cases, in many couples, they are actually postponing their planning for a pregnancy for maybe for after 30 years of the age, maybe for after 35 years of the age. So this postponing the planning of pregnancy actually is responsible for, in major cases, the incidence as well as the prevalence of infertility. So age plays a very, very important role in a reproductive life. In any female, 20 to 30 years of age is considered as a best age of having a pregnancy, because in 20 to 30 years, usually they are having good number of eggs in the ovary as well as their quality is good. As their number and the quality is good, usually all the or usually almost 90 to 95% females conceive within 6 to 12 months of a marriage, or within 6 to 12 months of trying for a pregnancy. But as your age increases, after 30, your number of eggs goes on decreasing, your quality of eggs is also go on decreasing. After 35, apart from decrease in the number of eggs, the chances of having an abortion also increases. And after 38, chances of having genetically abnormal baby like abnormalities like Down syndrome, Edwards syndrome, and Patau syndrome also increases if you conceive naturally after 38 or the 40 years of the age. So effect of age is very important with respect to fertility. It is always better to plan your pregnancy before 30 years of age. But is it possible to have a good healthy baby even at the advanced age after 30 years? Yes, it is always possible, and many women conceive after 30-35 years of age, and some women even conceive after 40 years of the age also. But as I said, the chances of having abortions also increases after the specific age group. So, what can be done when you are planning for a pregnancy, especially in an advanced age, and you are failure to conceive? First of all, when you try for a pregnancy after 35 years of age, you should try naturally with a proper consultation from a fertility consultant regarding when is your fertile window, when you should have a timed intercourse, and you should try naturally at least for the 6 months. but you should not delay more than 6 months to go to the consultation if you cannot conceive. So after your marriage, you try at least for the 6 months, and if you doesn't conceive, if it doesn't get a success in a 6 month, try to consult your fertility consultant. And once you visit your fertility consultant, he will advise you to do some of the basic investigations, like the investigations to know how many number of eggs are there in your ovary, what is the quality of that those eggs, how is your uterus, how is your fallopian tube. Apart from, he will also ask your partner to do a semen analysis in order to know how is your semen analysis. Once the evaluation is done, the fertility consultant will advise you regarding the appropriate plan of a management. So when you are in the advanced age, usually advanced age female can be categorized into the two groups. One which is having an normal AMH. AMH is the AMH is the hormone which tells us about the quantity of eggs in your ovary, which we usually confirm with the help of antral follicular count sonography. So if you are having a AMH more than, let's say, 1.5 to 2, then in that case, even when you are in an advanced age group, there are very good chances that you will conceive naturally over the period of next 6 months. So in those female who is having a good ovarian reserve, which we have confirmed with the AMH as well as with the help of sonography, that is antral follicular count, in those female we usually advise to do a sonography in order to know how is the uterus, is there any abnormality into the uterus. We also advise couple, we also advise female to do hysterosalpingography, a test which is done in order to know whether the tubes are open or not. And apart from that, we will also advise her partner to do a semen analysis. If the semen is normal, if the hysterosalpingography says tubes are open, if uterus is normal, in that case, and AMH is good, in that case, even in the advanced age group, you can try for timed intercourse with or without ovulation induction. Now, what is this timed intercourse? Time intercourse means having an intercourse in a proper fertile window. Now, how to calculate this proper fertile window? Fertile window are the days in your menstrual cycle where the chances of pregnancy is maximum and where the chances of ovulation is maximum. Usually, around 14th day, eggs gets mature and gets ruptured, right? So if we consider a 14th day, then from 11th to 17th day is an fertile window. This fertile window can be calculated by subtracting 14 from your cycle frequency. Suppose your cycle frequency is of a 30 days, then just subtract 14 from it, then the number will indicate the probable day of ovulation. So 30 minus 14 is 16. So if you are having a cycle length of 30 days, then 16th will be your probable date of the ovulation. Then 3 days before and 3 days after will be your fertile window. That is from 13th to 19th day will be your fertile window. So in all advanced age female group, if you are having a normal AMH, if you are having a patent tube, if your partner's semen analysis is normal, in that case you can safely try for a timed intercourse over the period of next 6 months. Suppose, but suppose if there is any problem in the tube itself or in the uh, sperm of a husband itself, then if you are having a problem with the tubes and if your AMH is normal, you are in the advanced age group, then in such a cases it is better to go for the test tube baby or IVF or the ICSI as early as possible. And suppose still if you don't want to plan for a pregnancy, if you want to postpone the pregnancy, then you should consider egg freezing or the oocyte freezing. Similarly, if if your husband's sperm is very low, let's say 5 million and 10 million, and if your tubes are normal, if your uterus is normal, your AMH is normal, then also you should go for the test tube baby because you are already in the advanced age group. So in the advanced age group, if you are planning, if you need to go for the test tube baby, then you should undergo a procedure called as pre-implantation genetic testing before transferring the embryo in order to know whether the embryo is healthy or not. As I already mentioned, the chances of having an abortion increases in an advanced age group. And this chances of having an abortion increases in advanced age group because of the genetic abnormality in an embryo. So it is always better to know beforehand whether the embryo is genetically normal or not before transferring it into the uterus. Now, the second category of the females in an advanced age group is where the number of eggs are less or the AMH is less, and it is less because of the age effect, and secondly it can be because of some of the genetic disorders or some of the other pharmacological treatments like treatment for cancer or radiotherapy, because of which number of eggs has decreased. So in advanced age group, most of the female are having a less AMH, that is AMH less than 1.5 or the less than 1. In those cases, there are usually two options. The, there are usually two options, either doing a test tube baby with the self X or doing a self test tube baby with the donor X. Now, why I'm not advising a IUI or natural in time intercourse in those females, because as your number of eggs are already less because of less AMH, there is a chance that you you will lose egg in each your menstrual cycle, and you may land up in a condition where donor egg will be the only option available over the period of next 6 years, next 6 months, 1 year, or maybe over the period of 2 years. So because you are running against the time and your biological clock is ticking, so if you are having a less AMH, you are already in the advanced age group, then you should consider IVF as a first option rather than an last option. So in all these cases, either we can go with the self X or with the donor X. But first, we should try to go ahead with our own X only. Unless and until we try with your own X, we will never come to know about the potential of our own X. So, can we try with your own X in the advanced age group? Definitely, we can try with own X in the advanced age group. This we can do either we can do in multiple ways. First is embryo pulling. So, what we do in embryo pulling, whenever you are having a less number of eggs in the ovary, naturally you tend to have a less number of embryos in the IVF also. When you are having a less number of embryos, the chances of having conception in a first transfer itself decreases. Also, in an advanced age group, chances of formation of a good embryo also decreases. So in all such females, we first plan 3 to 4 cycles of ovarian stimulation, and in these 3 to 4 cycles of ovarian stimulation, we try to make at least 3 to 4 good grade 1 quality blastocyst, and whenever we get this good blastocyst, we will transfer them at an appropriate time. So this procedure is called as embryo pulling, and many females get benefited with this embryo pulling procedure, and most of the females can have a self pregnancy with the self oocytes by considering this option of a embryo pulling. Secondly, this embryo pulling can be done with a procedure of ovarian stimulation called IVF flight, where we will give you a minimum amount of hormonal drugs or the minimum amount of the gonadotropins, so that you will have a very less amount of impact on your physical health. Secondly, we can try it with the help of the minimal ovarian stimulation. We can try it with the help of the conventional ovarian stimulation or an antagonist protocol. All these protocols, and along with some of the other advanced treatments like treatment with the growth hormone, treatment with the growth hormone, treatment with the PRP, treatment with the stem cell transfer therapy. All this therapy can be acts as an adjuvant in order to get the more amount of the eggs from your ovary, even in the advanced age group. So embryo pulling in an advanced age group in low AMH can be a can be a very good pool if you are considering and pregnancy with the self X. So even if you are having a low AMH and advanced age group, it is possible to have a pregnancy. So secondly, what makes the pregnancy at an advanced age so difficult? So as I already said, it is the number of eggs. Apart from the number of eggs which has decreased, some of the elements like diabetes, hypertension, asthma also increases in an advanced age group after 38 years. Also, you may develop cardiovascular disorder in an advanced age group in the advanced age, because of which you may get difficulty in a conception. So can it possible to have some option because of which you may not face this problem of low AMH group even if you postpone the pregnancy in a young group? So nowadays, oocyte freezing is a wonderful technology, and if you are considering to postpone your pregnancy because of the career or because of the education, and if your age is in between 20 to 30, and you want to plan the pregnancy after 35 years age group, then oocyte freezing, you should consider oocyte freezing as a preventive tool in order to increase your chances of having a normal healthy pregnancy after 35 years. So oocyte freezing is the best option. It is very simple, it is very safe, and it is very effective in between 20 to 30 years of age group. Whenever you plan for the postponing of a pregnancy, just visit your fertility consultant, have a discussion with your fertility consultant, do a basic checkup like AMH in order to know till what time you can postpone your pregnancy, and till what time you can actually have a natural conception. And once the discussion is done, think about the oocyte freezing. Oocyte freezing is very simple, as I already said, and it's an effective method which will help you to increase the chance of pregnancy even after 35, and along with that it will also decreases the chance of abortion even at the advanced age group. So thank you all. This is about how we can plan a pregnancy even at the advanced age group. So even if you are more than 35, uh, it is possible to have a pregnancy with your self X if we plan appropriately and if we plan before ended. So now we will go to some of the question and answer session. Question answer session. So first question is advanced maternal age group considered high risk? Definitely, advanced maternal age group is an high risk pregnancy. Why it is high risk? Because at the advanced age, there are higher chances that you may develop the elements like diabetes, hypertension, asthma, as well as a pregnancy itself can get complicated by preterm labor, that is the labor before 9 months get completed. Sometimes you may face a problem like oligohydramnios in a pregnancy. Sometimes you may face a problem of a big baby in a pregnancy when you are in an advanced age group. So advanced age group comes with a lot of obstetrical complications. So that's why the advanced age group is considered as a high risk pregnancy. But even if it is a high risk pregnancy, nowadays, because of the scientific advancement, we are at a better position to manage all those high risk pregnancies. So there is no need to scare of it, but yes, it is important to plan it and manage it appropriately. Why does oocyte quality decrease with the age? Yes, oocyte quality decrease with the age because of the increase in DNA abnormalities and because of the decrease in mitochondrial dysfunction. Because of the increase in mitochondrial dysfunction. What should I know about the birth defects? In between 20 to 30 years, the chances of having birth defects are very less. But as you cross 30, as I said, the number of eggs also decreases. But along with the number of eggs, the damage in a DNA also increases. Because of the increase in a damaged DNA, the chances of having abnormal baby, like the baby with the Down syndrome, Edward syndrome, and the Patau syndrome, also increases. So it is better to plan a pregnancy before 38 years of the age group. After 38 years, almost 1 in 30 female can have an Down syndrome. How often should I review my reproductive life plan? If you are in between 20 to 30 years age group, then whenever you are planning to get married, at that time it is best time to check for the reproductive lifespan, and it can be done with the help of simple blood test called an AMH and a sonography of a pelvis. But if you are more than 30 years age group, then you should check for your reproductive lifespan yearly by doing this blood test and a sonography. And after 35, every 6 monthly you should do an AMH and an sonography in order to know how much time you are left to conceive naturally, or should you consider a oocyte freezing or not. When should I consider an infertility evaluation? If you are less than 30 years of age group, then after 1 year of a marriage or after 1 year of successfully trying of a pregnancy, you should consider an evaluation for infertility. But if you are more than 30 and in between 30 to 35, then in that case, after 6 months of trying for a pregnancy, you should consider for the infertility evaluation. In between 35 to 39, after 3 months of your marriage, you should consider for the fertility evaluation. And if you're more than 39, then immediately after deciding for planning a pregnancy, or after immediately after your marriage, you should visit a fertility consultant for the proper evaluation. What are the risk of later pregnancy? The later pregnancy can have a risk like diabetes, hypertension, then preterm labor, premature rupture of membrane, infections, postpartum hemorrhage, macrosemic baby. All these complications can happen in late pregnancy, but these complications can be better managed now than before. What timing ticks or treatments might increase my chance of conceiving quickly? Okay, the chance of natural conception increases if you plan a intercourse in a fertile window. As I already mentioned, the fertile window can be calculated by subtracting a 14 from your cycle frequency days. Suppose your cycle frequency is of every 30 days, then you just minus 14 from that, you will get a number called 16. The number which you get after subtracting a 40 will indicate the approximate day when the ovulation will occur. And 3 days before and 3 days after that consider as a best time for having intercourse in order to improve the chances of pregnancy. So in this case, if you are having a frequency of 30 days, just minus 14 from 30, you will get a 16. So 16th is is an approximate day of your ovulation. So if I minus a 3, that is 13th, and add a 3, that is 19. So 13th to 19th day is a time when you are having the best chances of pregnancy, and this is called as a fertile window. So what types of prenatal testing are available to me to screen for chromosome abnormalities, and what are the risk of testing? So this is very important question. What type of prenatal testing are available? So most important prenatal testing available is the pre-implantation genetic testing for aneuploidies or the monosomies, right? So whenever you are in an advanced age group, first, if possible, first of all, consult with your fertility consultant, talk with your fertility consultant regarding this pre-implantation genetic testing. So what we do in a pre-implantation genetic testing, first of all, we do a simple IVF, we make the embryos. After making the embryos, we develop them for 5 days, that is till the blastocyst stage. And at blastocyst stage, we take out 3 to 4 cells and we send these cells to a laboratory in order to know how their genes are, whether they are genetically normal or not. And suppose if I'm having 10 embryos, and if the laboratory says 3 embryos are good and 7 embryos are bad, then we will transfer those 3 embryo into the uterus in order to maximize the chances of pregnancy. So this is the tool which is available before doing an embryo transfer. Other tools which are available to detect the abnormalities are after the pregnancy. Suppose once the pregnancy is confirmed, then we can do non-invasive prenatal testing by simply collecting a blood sample from a mother, and we usually segregate the fetal DNA from that maternal blood, and we study the DNA in order to know whether the fetus can have a genetic abnormality or not. Secondly, in between 10 to 12 weeks, we do an knuckle translucency and nasal bone scan along with the dual marker testing. Around 16 weeks, we can do a quadruple test. At 20 weeks, we can do an anomaly scan. At 22 to 24 weeks, we can do a fetal 2D echo. And after 28 weeks, and uterine Doppler. These all testing can help us to know about the status of a baby in a pregnancy, especially in an advanced age group. What pre-existing condition might impact my odds of getting pregnant or carrying a healthy baby to the pre-existing condition like diabetes, hypertension, asthma, then renal disorder, liver disorder, respiratory disorder like tuberculosis or pancreatic disorder. All these disorder can impact your odds of getting pregnant or carrying a healthy baby to a term. So I think that was the last question. Thank you all for the patience listening. If you have any queries or any question, you can type in a chat box, or you can also call on our helpline number or the customer care number, where we will be happy to help you and happy to answer your queries. Thank you.